Started. Good morning, everyone. Thanks for joining us for the Healthy Oregon Workforce Training Opportunity or HOWTO Grant Programs Advisory Committee meeting. We are just getting started. I am just also recognizing, Katrina, I think you've got the wrong slides up. As it says April 23rd, which I hadn't got. Thanks, Katrina.
Yeah, just 1 second.
And I see you in the PowerPoint, so I know you're in the same file as I am, so just a different screen share. Well, I'll introduce myself. I know we're still expecting several more folks to be here. It's a small group compared to those that had accepted. So hopefully we'll still have a few more folks join, but we've still got plenty to talk about. And excited to have the opportunity to touch base with you all. As you've already gotten the reminder, the meeting is recorded, so those who aren't able to participate will be able to post the recording and share that out. It is a public meeting, so we also welcome, in addition to our OHA staff and the HOWTO Advisory Committee members, we welcome members of the public that are interested as well. Thank you, Katrina. Perfect. We have about not quite an hour and a half to spend together today. Time always flies. As a reminder, I'm Melissa Yates. I use she, her pronouns, and I am the HOWTO program coordinator. And really excited to have you all here with us today. Just a few logistics that we'll walk through as we kind of get our bearings for the meeting, talk a little bit about the agenda, and then we'll kind of get into the heart of our topics for today. So as I mentioned, it is a public meeting, and we do welcome public testimony during the public comment section, which we'll have here shortly. The meeting is recorded, as well as offering live transcription, which is an option at the bottom of your Zoom screen. Sometimes it is tucked away under More, the little circle with the 3 dots, and you can select the captions option there. For our committee members, if you could rename yourself, I see Rob is already ahead of us. If you could add CM for committee member at the front of your name in Zoom, that's always helpful for us just in terms of tracking our logistics as we're scanning through the folks that are here. And you can just do that by right-clicking over your name, over your little Zoom window where it displays your name, right-clicking. Rename is at the bottom there. So you can add in CM for our committee members. As we work our way through the meeting, please feel free to use the chat or raise your hand for our committee members and staff that might have questions as we work our way through. So we can always feel free to chime in. We have time set aside for public comments, which will be our first section of the meeting. For members of the public that are interested in sharing before we get started. So just a quick walkthrough of the agenda. As I mentioned, we'll have the public comment time here in just a minute. Then we'll walk through some introductions with the OHA staff and our HOWTO Advisory Committee members. Then we'll spend some time on program updates, just kind of what's going on currently with HOWTO, and then spend some time talking with advisory committee members as we think about, this expanded advisory committee is still pretty new to the program. So continuing to think about how we work best together and what works best for committee members on engagement and information sharing. And then we'll wrap up. So pretty quick meeting, always lots to talk about. So again, really appreciate you all being here with us today. So with that, we often start the meeting with some public comment if we have anyone who is interested in sharing. I haven't heard from anyone who signed up for it yet, but we don't require folks to sign up in advance. So if there are members of the public that are interested, we would welcome getting to hear from community members on the topics that the committee considers, or other topics that you might be interested in sharing with the group. Typically, we ask for about 2 to 3 minutes in terms of time for the public, for each member, member of the public that wants to share. And then we don't respond to public comment in today's meeting, but can follow up outside of the meeting as well. So all of that said, is there anyone here that would like to share any comment with the committee members?
I do not see any hands raised, Melissa.
Thank you, Jessica. Well, and with that, we will go ahead and move on to the next section. I don't see any comment and didn't receive any notification, but it's a small group today, so that makes sense. Great. So as I mentioned, it's still kind of a newish group, right? Having the opportunity to get together, learn more from each other. We also have some new faces in the meeting today, which we're really excited about. So as always, we want to spend a little bit of time to start off with just a few introductions from the OHA team, and then spend some time with the advisory committee members, hearing more from you as well. So as I mentioned, I'm Melissa Yates. I use she, her pronouns, and I'm the HOWTO Grant Program Coordinator. And if my colleagues here that are a part of supporting the HOWTO team, if we could work our way through our little list here for some introductions, your name and role and pronouns, that'd be great. Neelam, would you like to get us started?
Yeah, sure. Hi, everyone. Neelam Gupta, she, her pronouns. I'm the Director of Clinical Supports, Integration, and Workforce, which sits in the Health Policy and Analytics Division at the Oregon Health Authority. It's so nice to be here with you all this morning.
I think I'm next. Hi all, my name is Ritu Tungana, she, her pronouns. I am the manager for the healthcare workforce team. And I'm so excited to be a part of this group today and learn more about the work that's going on around HOWTO. I'm going to pass it to Jessica.
Hello, I'm Jessica Malmstrom, she, her pronouns. I am admin support for not only the HOWTO program, but as well as the Healthcare Workforce Committee and the Health Evidence Review Commission. So I'm running things behind the scenes today. I am recording. I turned the captions on. Message me if you have any administrative questions or concerns. And I'm going to, well, you know who Melissa is. Melissa, did you need to do another introduction?
No, I think everybody's heard my name multiple times already today.
All right, so I think it goes to Katrina.
Perfect.
Hi, everyone. My name's Katrina Dowdy. I use the pronouns she, her, and hers. And I am a newer addition to the team. I am the Healthcare Workforce Pathways Coordinator. What that means is I'm really splitting my time between the multitude of ways that we support the healthcare workforce pathway. So some of that is within HOWTO, and then the other is provider incentive. And I'm really just walking the line supporting between the two. The way that I will be supporting HOWTO is specifically with this advisory committee. So I'm really looking forward to building relationships with you all. I have extensive public meeting experience as a school board director and a longtime public health advocate. So just excited to dive in and do the work with you all and help hold this space. I've had the opportunity in the past to evaluate and review HOWTO grants. So I feel like I have been periphery to this space before, and so it's nice to just really be able to dive in with you all. And on that note, I think that we're hoping to have the opportunity to learn a little bit more about you. So I would love for folks to go around. And when you wrap yours up, if you could call on someone else, I think that really helps us keep the flow going. But just share with us your names, your pronoun, your organization, and then I think it's really helpful to highlight something that is going well for you all. And then sometimes these spaces allow us to have collaborative problem solving opportunities when we see patterns. So we'd love to know a rose and a thorn that you're seeing either in your work or your community right now. And I'll just call on someone to get started and we can get the ball rolling. So Claire, do you mind kicking us off?
Sure. Hi, I'm Claire Chancaise. I use she, her pronouns. I work for the Oregon Primary Care Association. So that is the association of all of the federally qualified health centers in the state. And of course, I thought of my thorn a lot faster than my rose, because, so I'll start there. The thorn is that we just lost our primary workforce person, and one of the biggest challenges we keep seeing again and again for us and our health center members is like, we don't even have workforce to work in the workforce space. And there's a lot of turnover just in those HR roles and whatnot. I guess a rose, though, is that there's still a lot of energy around workforce, and we have been applying for our own sort of additional funding to try to build up what we have and how we can support all our members. Yeah, so that's me from the OPCA, and let's see, I will pass it on to Rob Ross. You're next in my lineup.
Good morning. Sorry, had a little delay in unmuting myself. Hi, I'm Rob Ross, he, him pronouns. I'm the director of academics and research at St. Charles in Central Oregon. I'm a family physician by trade. Let's see, a rose. A rose came to my mind because, we just started a family medical residency in Madras and hired our first residents. And that was thanks certainly in part from the help we got from HOWTO. So very grateful for that's 4 or 5 years ago. It's a long time ago. But the fruit of that work is coming on the tree now. So that's wonderful. A thorn, I've got to tell you, I've had a lot of health issues recently, personally. And a thorn is that I just can't believe how complex and inaccessible the healthcare system is for people who don't have friends or family or whatever. It is so messy and so confusing that even someone who's navigated it and worked in it for 40 years, it's just amazingly bad. And the access is unbelievably delayed. It takes months to see people. And I'm talking about, physicians in this particular case, but I'm sure people with other issues, social determinants or whatever, still are experiencing the same sort of delays and problems. And it's pretty regrettable, given that, we should have a functioning healthcare system. We spend enough. So that's the biggest thorn. But, I'll take the rose. Who should I pass it to? I don't see, do I see anyone on here that is not on the state? Let me see. Any ideas? Someone can help me.
Yeah, we could pass to Emily.
Okay, that sounds good.
Hi, I'm Emily Lamson-Sue. I use she, her pronouns, and I work with the Oregon Center for Children and Youth with Special Health Needs. We are OCHN. We are the state public health agency for children and youth with special health needs. are located at OHSU, but are technically part of the Maternal Child Health Block Grant, the sub-award through OHA. That's the front end. Let's see. I think Thorn wise, mirroring what other folks have said, we work closely with a lot of the local public health authorities around the state, supporting home visiting programs for children and youth with special health needs. Those programs are clearly still seeing quite a bit of turnover, which is just makes service access challenging for families. I think we have seen some expansion though, adding, and I think I said this last time too, that those folks are adding more community health workers to their workforce as we go though, which is a kind of bright spot. We also have been working for the past year on a Spanish language cultural adaptation of a community health worker course that we wrote to build capacity specifically for community health workers to support children and youth with special health needs. In that process, we've connected, we're working with the Next Door in the Gorge, and they are connecting some Latino parents to that course development process. And quite a few of those parents are now interested in taking the course themselves. And so we're really having lots of conversations about pipeline development for parents with lived experience as parents of Shin. And that's been really exciting and great to see. So that's what I have. And I will pass to Nicole.
Good morning, Nicole Krishnaswamy. I use she, her pronouns. I am the Executive Director for the Oregon Medical Board, and pleased to be part of this group talking about how we can build capacity within our healthcare systems in the state. A rose for me, I think, is increased conversation around shared issues and trying to learn from each other and partner more. I've definitely seen more of that in the last year than ever before. I think folks are really committed to getting on the same page, identifying the problem, and then finding solutions rather than just sort of blaming each other, which has been really wonderful to see the conversations and the shared efforts that are happening. Really excited about that. And for Thorn, I think we're still seeing such burnout and mental health concerns among provider populations. And it seems like as much efforts as we put into recruiting new physicians and PAs and nurses and everyone else into the state, we're losing folks at a faster rate than I would like to. So we've been focusing a lot of our efforts around mental health supports for physicians and PAs, and now nurses are involved in that as well. And so I think that's an area that I would like to see more attention placed on. Just how are we taking care of the people who are already part of our healthcare community and keep them functioning at the highest capacity possible. And I will call on Bob Dumick.
Hi, good morning. I'm Bob Dumick. I'm the director for the Oregon Office of Rural Health. Excuse me. I think my big thorn is, man, there's a lot of work to do. And so every time you think you're getting a few steps ahead, there's just more need. But on the other side, the rose is, I feel like we are getting somewhere sometimes. So I think our conference this last year has really brought a lot of folks together and showed that there's some really good success going on out there, a lot of conversation. We have been able to hire some new staff to do technical assistance for our facilities, and we brought on some additional workforce folks, and I think that's all coming together very nicely. So, yeah. And so let's see. I will go to Jeff.
Hi, my name is Jeff Knapp, and I use he, him as pronouns. I'm executive director of the Oregon Optometric Physicians Association. And I have a rose because it's timed well. We put together a workforce task force with a goal of recruiting and retaining workers in the field of optometry. para-optometrics are key to the success of all of our practices. And we have a new agreement that was just formed between the Para Association and our association. And it took a long time to work out the nuances just to make sure that we had everything in order. But I'm really, really thrilled about it because there are 3,500 para-optometrics across the state of Oregon. And amongst that group, just a fraction of them are currently certified. And so our goal is to be working with the dual associations on certification of our paras, which is going to help practices. And there's a whole lot of data that's available through our national organization, the American Optometric Association, showing the ROI on certification of our paras. And so I'm really, really excited. We've got a really, really good leader head of that para association. One of our first goals is to get out into the community and offer up optometry as a career opportunity. And this Saturday, we're going to be in Salem as part of the Girl Scouts STEM Day program. So we'll be presenting all of our information and hoping that some people take a look at optometry as a field. But you know it's a lot of momentum that we're gaining, and once we get a whole bunch of people certified, unfortunately there's a cost to certification, and so I'm going to be looking for some sources for funding for individuals who want to get certified. There's a high degree of retention of people who are certified. And so things are heading in the right direction. We've been meeting almost all year to get to where we've gotten. And so in addition to the STEM Day, we also have a health fair in Hillsborough on Saturday, where we're also going to be presenting, again, offering up optometry as a field. I don't really have any thorns, frankly. I'm going to just bow out when it comes to the thorns. And so I don't know who's left on our hit list here.
Juan, have you gone?
Hello, good morning. Hi, my name is Juan Pablo Villalobos. My pronouns is él. I'm representing Latinx Recovery Center, Inc. I am the executive director. Latinx is one provided education by NADA and MACBO. And the question is really interesting. The roles, in my opinion. So my culture Latinx is so involved in the education for professional development. So this is really interesting. So right now I have a lot of professionals for the behavioral health, culture specific. So sometimes my partners in the rural areas call me, hey, Juan Pablo, I have a 10 or 20 person interested in and obtain one certification for PWS, PSIs. This is excellent numbers in the rural area. And the torn and sometimes it's complicated. So for the capacity, the Latinx is small. So sometimes it's complicated, provide more services for education, more CU in different area, especially in the rural area. So it's complicated. So sometimes I'm working really hard and provide more education free and in different modalities, online or in persons. So right now it's very important for the Latinx provide more education and certification. So technically it's not a storm. So it's the benefits. So it's the balance. It's complicated. So thank you. I'm excited for stay here. And this is a really good opportunity for all the community. So thank you so much.
Thank you so much. And I think our last member is Robert.
I think we have David hasn't introduced.
Oh, sorry, David. Yes, my screen moved.
No problem. David Robinson, I'm the Executive Vice Provost here at OHSU. I use he, him pronouns. We should start with the roles, as it says in the list there. And obviously, we just started a new academic year, which is, by the way, our academic years start all the year round, but we always think of October being the start of the big academic year. And so, that's always an exciting time to see all the new students come in and even the returning students come to campus. So that's a rose. I think, seeing Rob on here, the other rose that we should mention is, one of the things we're doing through 30-30-30 is expanding our class sizes where at all possible in certain of our healthcare degree programs. And one thing we did starting in October was launch a new accelerated baccalaureate program in Bend in collaboration with St. Charles. And so we have 8 students just started their accelerated baccalaureate program in Bend just a few weeks ago. So that's a good start, and we'll see how that goes and whether we can expand that in future years. The thorn, it's always a double-edged sword. Increasing class size, it's hard to increase class size unless you can actually find training sites for these people to actually training. We actually have the capacity to increase the number of our degree granting programs to help the workforce shortage. The issue we have is finding places to train those individuals around the state. And, obviously the nursing program is a great example of a collaboration with St. Charles that's worked very well to be able to move forwards in that area. But, we're continually looking for clinical partners to allow us to utilize their facilities as well as obviously trying to grow our own facilities. But clinical placements, there's an awful lot of people from out of state who use a lot of our clinical facilities. And then those people, go back to the East Coast or whatever and have no intention of staying in Oregon. And, it'd be really good to actually try and find those clinical, find a way of having those clinical placement sites being utilized by people who are likely to work in Oregon once they've qualified. So that's a nut to crack and a thorn that we've been working on for many years. And there's no easy solution to this, but that would be something that would, be magical if we could solve.
Well, I'll work on fashioning that magic wand, David.
Well, exactly.
But thank you, each and every one of you. I feel like it's really helpful. I saw so many nods and smiles and like moments of inspiration hearing about folks' rows. And I think there's equal value in hearing about thorns because a lot of times we do find out we're not alone or find ways to collaboratively problem solve. I think Nicole really highlighted that there's a lot of power in coming to difficulties together and uniting on things that we may all be running into. So I'm really grateful to have this space with you all. And thank you for those introductions. And then now we will pass it back to Melissa for some updates.
Thank you. Yeah, really appreciate you all sharing, as Katrina was saying, just the opportunity to get to know you all, but also the experiences that you all are having out in your organizations and your communities as we try to think about, not just what's next, but kind of where we're all sitting right now. So really appreciate that. And, I know in this space, we're always trying to juggle this balance of sharing information from the HOWTO program on what's going on right now, as well as making space to hear from you all as advisory committee members. So we wanted to spend a little bit of time up front talking about current and recently completed grantees, just to give you a little bit more info on what's in motion. So right now, we have 26 active grantees. That's of our 40 total. So we do have 14 projects that have completed across our 5 current rounds of grantees. So pretty impressive to have just seeing the accumulation of the different projects, and as projects are completed and just in different stages of implementation. We had the opportunity to get grantees together for the annual all grantee meeting back in September, which feels like a million years ago now, but actually was not that long ago. I know that advisory committee members were also invited to participate in that. We also have a recording of that meeting for those who might be interested. But it is just such an incredible window into what folks are doing, and similar to what Katrina was saying, both the sharing of victories and the challenges, right? So really took grantee feedback on what they wanted from that meeting. We tried to think about the HOWTO grantee community, right? Not just separate projects. So hearing from grantees on what they wanted in that space. There's a really big emphasis on getting to hear about those shared challenges, and also think about how folks are planning for the future of their projects. So some of the grantees that we got to hear from in that space, we have 3 grantees that are part of the Oregon Workforce Partnership, but they're doing behavioral health related projects. And so that was Willamette Workforce Partnership, Northwest Oregon Works, and East Cascade Works. They did a shared presentation about their projects. We also got to spend some time hearing about the Community Health Aid Practitioner Program from the Northwest Portland Area Indian Health Board. That's part of their tribal community health provider projects. And then we had 2 breakout sessions to hear from Virginia Garcia Memorial Health Center. They have a grow your own or pathways style project to focusing on workforce needs. And then we also had a session on traditional health worker, both training and utilization. And that one was hosted by the Southwestern Oregon Workforce Investment Board, which is one of the round 4 grantees. So just a lot of information sharing in a short amount of time. If you can call 3 hours a short amount of time, it is a lot of projects. And one of the pieces of feedback that we've heard in the past, and we continue to hear from grantees, is just an interest in having more opportunities to come together and share. And so with some of the added capacity that we're excited to have Katrina on board to support the HOWTO program, one of the things we're looking at to start in 2025 is some quarterly meetings that are optional for grantees, developed out of what grantees want to spend time talking about, and have the opportunity for a subset of grantees to come together and share in those spaces. So really trying to think about how we facilitate the connections and the information sharing, and just how we can help elevate the learnings that are coming from those projects. So that annual all grantee meeting is always such a great energy and just a wealth of information to share. So that was a big success since we had the opportunity to come together with this group. A couple other highlights to share since we last saw you all. We had 2 grantees complete recently. One was the Clackamas Workforce Partnership. They had a project focused on what they categorized as high demand healthcare training opportunities. It was a partnership with the Immigrant and Refugee Community Organization and Clackamas Community College. So they just wrapped up that project. And then East Cascade Works, which I mentioned, has their project was the Central Oregon Behavioral Health Consortium. They also recently completed, and one of our advisory committee members who wasn't able to join us this morning, Adam Dickey, is the director of that consortium. So had the opportunity to share some more about that in the all grantee meeting. So if you all are interested, there's some other spaces where we've got some more information about those projects. And then each year we have 2 progress report periods from grantees. We touch base. Reporting is due at the end of January and the end of July to get updates on all the logistics, spending, things like that. We also get a progress report from them that includes a lot of narrative information about what's going on in the programs in the last 6 months. And it also includes some metrics that they report to us twice a year. So we also wanted to share a bit about the current workforce training participant numbers, just to show it's 40 projects right across 5 rounds. But how we help to tell the story of what those numbers mean is one of the things that we're always excited to talk about. Which looks really tiny on your slide. And so just as a reminder, if in the glory of Zoom, hopefully you all are able to see that a bit. One of the things that we wanted to highlight here, and we do have the PDF attached to the calendar invite as well, if you want to pull it out in a separate space. But kind of what I wanted to do is just, thinking again, 40 projects, wildly differing training programs that are part of those projects, right? We have everything from getting high school students interested in healthcare to getting those family medicine residents, right? So the trying to capture the wide range of projects and the wide range of impacts is a big task. And this is just one way to capture the numbers, right? Again, numbers are one piece of the story. There's so much narrative and so much richness behind each of these numbers that tells the story of both the program, the impact on the trainees, right? The participants in the training programs, and then the impact on community and patient access. So as much as I'm a numbers person, I do always like to give that sort of little asterisk to the comment that we know it's just one piece of the story. So this is just wanting to highlight a bit about, since the HOWTO program got started, the cumulative total of training participants that have taken part so far. And so what we've done, the top half there is looking at new workers trained, right? So folks who are coming into the healthcare workforce. The bottom half of the table is looking at people who are already in the healthcare workforce that are being trained with additional skills. And we have a good majority of projects are looking at new workers trained, but we definitely have projects that are looking at that retention and career advancement and things like that. So just trying to think about how we help to convey those two pieces. We also have to date 5 rounds, right? And these are still in varying stages of implementation. The first 2 rounds, those projects are completed, but rounds 3 through 5 are still in progress for grantees. So all of that is a lot of context setting to even get to talking about the numbers, right? But just as some of that stage setting, one of the things that you might notice, just in our top section there, we are fortunate to have a pretty wide range of projects that were focused on community health worker and traditional health worker areas. So that's that first row there, we've had 510 new workers trained in those areas. We also have had, and I won't go through every single line here, but you can see behavioral health grad education, a pretty wide range of certified professionals, the behavioral health aid, that's one of those Northwest Portland Area Indian Health Board projects, so behavioral health aid practitioner program. And then a wide range of primary care, residency, and internship programs, as well as the mental health crisis responders. So trying to capture a bit of the numbers, while also at the same time, one of my favorites to call out in this table is looking there at round 1, that second row, behavioral health graduate education. It shows 9. And 9 compared to one of the other, the number right above 158, it's like, oh, it was only 9. And then we go to that other, what's the story behind those 9, right? That was actually the Northeast Oregon Area Health Education Center's psychiatric mental health nurse practitioner program. So the impact of those 9 folks who were able to provide clinical care in Eastern Oregon is huge. And the big story behind that too is that it was the development of a program that is still continuing, right? So this was really just the start of getting that program off the ground and getting folks through a training program. The story of all the impacts that come after, right? That HOWTO funding is over, but the program has been built and continues. That 9 doesn't have the confetti and the celebratory like context around just seeing that number, right? So I always like to try and provide some of that. Just the numbers are one piece of the story. We're always trying to think about how we continue to provide that narrative that goes around each of these projects, and seeing, HOWTO projects are typically for up to 3 years. We do have some that get extensions, no cost extensions, as timelines sometimes get shifted over implementation, but typically it's about 3 years. So it's short-term measures of what we all know are often very long-term impacts, right? So one piece of the puzzle, but a really exciting piece of the puzzle to see these numbers and think about the impacts on the community, and also on the folks who were able to take on these new roles. Often, like with the NEO-AHEC program, without having to leave their community, right? So getting folks trained and able to participate in the workforce in the community that they're connected to, and that's in need of those services. So all of that is a lot of explanation to try and think about how we celebrate the victories that are behind each of these numbers. In the bottom half of that table, we are looking at folks who got additional training, who were in a pretty wide range of healthcare roles. So some of these are like the behavioral health trainings. You'll see some asterisks in this part of the table. And because this is, again, we have these really wide-ranging types of projects. Some of these are cohort-based, right, where they might have connection to a program for 6 months or a year or longer. In other cases, it is day-long trainings. And so that's where there's some, the ways that these are reported, they weren't, the workers could take multiple trainings. So there could be some duplication in the numbers for those that have the asterisks. And that's why then at the bottom of this table, we're only tallying the total of the unduplicated numbers. Just to try and think about how we take a snapshot of the different types of projects that are a part of these programs. So again, ongoing projects in rounds 3 through 5, but trying to also highlight, we pulled out the high school dental camp. That's a program with Clackamas Community College, connecting back with high school students. That's not to say that that's our only HOWTO grantee looking at how we support high school students. We also have projects back in the top of the table there where we're looking at new workers trained. Some of the grantees like Virginia Garcia Memorial Health Center, they have projects that are working with high school students, helping them to get some of those certifications, right? So those high school students are showing up in the counts up at the top. So a lot captured in one little table, but wanted to just spend a little bit of time talking that through and thinking about, one of the things that's very much on our mind from the HOWTO program perspective is thinking about how we continue to capture the story and help that story to have legacy that gets shared out with folks in a wide range of different ways to help this work be as visible as possible, as well as the challenges that the grantees are facing and working through. So any questions about that? I know there's a lot on that slide, but happy to spend some more time talking about it if there's any questions or comments. Also happy to talk about the HOWTO round 6 request for grant proposals if there's no questions there as well. Absolutely agree, Nicole. Thank you for your comment there in the chat. So much to celebrate. There is just incredible, and that I think every time we get together with grantees or have the opportunity to hear about their work in a wide range of other settings, just continuing to think about how we help to celebrate that and the realities of what went into getting to those numbers and those accomplishments. So. The other big thing that's going on right now for the HOWTO program is the current round 6 request for grant proposals. And I know we talked with you all about this in our last meeting back in April. So at that point, we were still in the preparation phase of getting the request for grant proposals approved and posted. The round 6 request for grant proposals is now up on Oregon Buys. I can drop that link in the chat too for folks who are interested in accessing it. Give me 1 second to pull the right link. And the RFGP or request for grant proposal posted back at the end of September. It's available until December 16th is the deadline. So one of the big pieces of feedback we heard with round 5 was about giving folks enough time to turn those around. So we've excuse me, we've stuck with a 12-week window for the request for grant proposals this round as well, based on that input. So it's been posted. We've had our first information session. We actually had 82 people in the first info session, which is definitely the biggest information session that we had compared to round 5. We have our second information session coming up on November 2nd. November 7th. All of that information is linked in the Oregon Buys posting. Folks can get the Zoom link there in that Oregon Buys request for grant proposal. It's the same information as in info session 1, though as people may be further in preparing their materials or have new questions, we will be responding to questions as they're posted. The request for grant proposal on Oregon Buys also has a question and answer tab for folks to ask questions. One of the big things we're trying to make sure that all questions go through that Oregon Buys page so that everyone can see both what was asked and what the answer was, just as an additional source of information as people continue to prepare their request for grant proposals. So that also is the kind of preview that you all can expect to hear from us as we get a little bit later in the year when we start to think about the review process for the proposals that we receive. We're with that December 16th deadline. We'll have some logistics to take care of as we wrap up and get things ready for the end of the year. And we're expecting the review process to take place in January. So we'll have some training for reviewers and some paperwork, and then a couple of weeks for reviewers to turn around their scoring. So just a heads up to our advisory committee members, we are always grateful for any that are able to take the time to participate in that review process. We do also recruit reviewers from the community who are interested in participating. So there will be more of a blast, email blast from us coming out as we get closer to that time point in the process. So the goal then is to have notification of awardees by March 7th. And then from March to mid-June, we'll be working through the grant agreement process, getting those contracts put together so that the goal is to be able to have those contracts in place and ready to go by mid-June. So this round, we do have 9 million in funding to award compared to just 3 million that we awarded in round 5. So really excited to have more to award, hopefully be able to award a larger percentage of the proposals. And also knowing that last round we had by far the largest number of proposals submitted compared to previous rounds. We're also really curious to see what the numbers look like for this round. So there's a big question mark still on how many we'll have to review as it moves through the process. But really exciting to see that move forward, and you all will hear more from us as that progresses.
I have a quick question. I
Sure.
know the Workforce Ready grants sort of just came through and then people got responses. Do you also expect people who applied for that might be applying for this grant as well?
Yeah, so in round 5, we had some overlap with the Future Ready timeline, and having that great collaboration with the folks at Future Ready, we did make sure to have a more staggered timeline this time compared to round 5, so that the deadline to submit for round 6 of HOWTO will be after folks have notification of if for some folks we know for round 5 did apply for both. So hoping to have our timeline this round more intentionally trying to keep those separate. There's definitely some differences in terms of eligibility and process and things like that between the two, but I'm just also trying to think about the big lift it is for folks, especially we have a lot of organizations that are smaller and don't have dedicated grant writers. So we're really trying to be intentional thinking about how that hopefully doesn't overlap to increase the demand on the organizations. We also made a lot of changes compared to round 5 in terms of the HOWTO process itself, based on experience with the round 5 and also feedback from folks who took part in that process. So I'm hoping to also see round 6 feel like a more streamlined process for folks while still existing within our big system. So trying to simplify where we can. All right. Well, thank you all for giving me the chance to share a bit about what's going on right now. And I am going to turn it back over to Katrina to talk with you all about thinking about how the advisory committee continues to work together.
Yeah, thank you so much, Melissa. And thank you for those updates. I'll say from an observer previously, it's really helpful to put all these pieces together. Full transparency, because I think it's really helpful to know how we all enter this space. The way I really got started with healthcare workforce work was on the BOLI side. So I was part of Future Ready Oregon's BOLI work and really trying to figure out how apprenticeship can be a part of the healthcare equity landscape. And so it just feels really meant to be to now get to join this space and have these discussions. And I appreciate, Claire, you asking about those timelines, because I think that is a thing we heard from community a lot is all of this work is wonderful and aligned, but how do we make the timelines jive better? And I think Melissa's done an amazing job at learning from all the different parties that are doing similar work and making that as collaborative as possible. So as far as the advisory committee and this space and how I can best support you all and hold this space for you, I had 2 key processes that I was really contemplating as far as what is meaningful engagement with the advisory committee and what does that look like for you all and what does that look like for me. And I know that, thank you, Neelam, for saying what BOLI is. I really try not to do acronym soup and then it just happens. I fall into that pot. So that is the Bureau of Labor and Industries. So as far as meaningful engagement, I know that we always are trying to find the balance between what our true capacity is and what feels like meaningful engagement. And it can be really tricky to walk that line. I know right now this group has been meeting twice a year. And so I think I really want to just start by having the discussion with you all, and there's no specific format. It's just kind of share and speak when it feels right for you. But I'd really love to hear from you all about if twice a year feels like it's walking that line for you of really recognizing your capacity, being an incredibly busy professional in your field, and simultaneously gives you enough engagement. I know some folks can lean a little bit more towards quarterly because they want to know a little bit more, be a little woven in, have more opportunities to build that collaboration, or not. The thing is too, I'll take space here and we'll have this discussion here, and then I plan on sending out a survey afterwards to just make sure I'm hearing what you all are saying, and then finding that data that is a good middle point for everyone. But I just wanted to open it up if anyone had specific thoughts or feelings about this.
This Bob. I like the twice a year. I think regular communication out is great, and I think you guys have always been very open to offering additional information if anybody has any questions in between time. So yeah, I think it's going well.
Thank you.
I guess my question. Oh, sorry. Go ahead, Nicole.
Sorry. I think that the twice a year meetings work well because, we don't need to have meetings if there's not content to meet about. But I think it would be helpful to have maybe like a newsletter or something that we're checking in and getting updates. Just, I end up serving on so many different committees and sort of getting them a bit confused on where we left off with each one. So if there's some kind of branding or newsletter that comes out that's really clear about what's happening with HOWTO, and maybe that's already happening and I'm just not in tune with it yet, but I think seeing some regular communication would be helpful to me to remain engaged.
Love that. Thank you for that feedback. Emily?
Yeah, I totally would agree with that as well. And I think my question for you all also is, are you getting what you need from us if we're meeting twice a year? Just depending on what kind of impact you're wanting to get out of this advisory committee. And I guess that would be I turn it back on you all for that reason.
Perfect. Thank you for that feedback, Emily. And just real quick, both for Nicole and Emily's feedback. I think I can speak on behalf of OHA at least on this specific regard is I don't think we're a fan of meetings for the sake of meetings either. I think having effective and efficient meetings is really the goal. And so if at this moment, and again, we'll send out a survey to make sure we know that there's also quite a few folks that aren't in attendance today. But if what is feeling good for your capacity and for having quality meetings continues to be the bi-yearly meetings, and then that more continuous update of information. The reason I had put that point, and I'm glad it felt helpful, is that I know there's plenty of committees I'm on that twice a year is plenty, but I kind of forget what happens in between those 6 months. And so if there's ways we can keep you all connected and engaged and maybe even make each meeting more powerful because there's not a lot of catch up that has to happen, that could feel really helpful. Melissa, as far as meeting our needs, if you could speak to that since I am new to the team.
Absolutely. I think, one thing I feel that same push and pull. I think the more time we have in these meetings to hear from you all, the better. And so I think we're getting what we need, and this group represents such a wide range of things that we don't always. The more information we can hear and process and help to connect the dots back with what's currently happening, and I think just as we move forward, how our timeline for like the request for grant proposals lines up to make sure we hear from you all in advance. I think we're getting what we need, but we can always learn more from you all. That would be my take. And one of the questions I would have too, just thinking about those gaps and whether or not, is it more helpful to have like a midpoint where you get more information in between, or is it something closer to before the meetings when our brain is in that meeting mode and trying to catch up right before, rather than having another gap in between communication? So I'm curious too, or maybe there's different needs at those two time points, because there is such a big lag in between. But agreed, more meetings is not always the answer there.
I would say in between is nice. In particular, I would love to know about the current grantees and like their projects, because that always just helps my workforce brain. Like I know a lot of it too is about how do you sustain and how could it be replicated. And the more I'm hearing about what's working well and if there's programs that we should like real time reach out to and intersect with, that's the kind of info I would find helpful, and then also really helps us as advisors sort of understand what's happening.
Yeah, I appreciate that feedback, Claire. I think that especially with what Melissa touched on earlier with the grantee meeting, being able to be a quarterly experience soon, I foresee at least if it was a bi-monthly email update that, for example, I sent out, that being able to both be updates on who the current grantees are, where we are in the process with the current round, those kind of things, as well as I would love to see, since we would have more of these frequent touch points with our grantees, little highlights about things that you might want to know about some of the grantees, and really being able to share that story in the moment, as opposed to reflective. And so I think that that's where those touch points don't require more time on your calendar, but do allow you to be more engaged. And then I think if we find that you all have some of the same questions, or you're really thinking, let's pull another meeting together because we want to have a work session or something, I think that that's where we can be flexible in what those needs look like. Is there anyone who hasn't spoken that feels strongly that they want more meetings? The grin from everyone tells me no. Perfect. Okay, well, since we do have quite a few people not here, what I'll do is I'll send out kind of a summary of what this discussion looked like and that survey, just to make sure we're finding good touch points for people. But I think the consensus from what I hear is we'll stick with twice a year, and we'll do bi-monthly email updates to really keep everyone in the loop, be able to talk more about our grantees. And then we'll continue just to have this be an evolving discussion. So if we find that that's not working, or there's more work that needs to happen, since we know this is a young advisory committee, then we'll just continue to evolve. Perfect. Thank you, everyone, for that discussion. And oh, look at that. We already discussed both the things we needed to do. How efficient. Okay, was there anything else, Melissa, that you really want to highlight as we're going into round 6, recognizing that we will not be meeting for another 6 months?
Yeah, I just that reiteration of the opportunity to take part in the review process. It is a huge lift to get all of those proposals reviewed. It's also a great way. You all have had the opportunity to hear about the projects that were selected, but there are so many tremendously just we aren't able to fund all of the proposals that we'd want to, right? Limited funds and just a wealth of really strong proposals in round 5. So it's just another great insight into what's happening across the state. So really would love to have your all's participation, while also knowing it's a big big time commitment, and we'll share more as we know how many proposals we have. We'll be thinking, we'll continue to recruit reviewers and try and think about how we help spread that workload across folks. But it's another great opportunity to hear more about what's happening in different spaces. And Emily, I saw your comment too about hearing more about the sustained work post grant cycle as well. And that absolutely, one of the things we ask grantees about as part of their final progress report is what their plan is. We ask up front, we ask folks, what's the plan to keep this going once it's over, once the funds are up? But we all know that what people propose before something has started, and then as things evolve through implementation, things really change. And we hear about that evolution throughout the grant period from folks and in their progress reports. But at the end of the funding, we also ask for the details on what's next. So thinking about how we continue to share that back with this group, and also how we continue to think about the HOWTO community of folks who have taken part in the projects and were grantees, how we continue to help shine a light on their work after the funds have passed as well. Definitely something that's on our mind, and how we build the systems and structures that help to support that, especially, again, HOWTO is fairly new in the grand scheme of things, right? With just recently having our round 5, and as the number of grantees continues to build and the impact continues to build, trying to think about how we build those systems to help that continue to be a part of our process.
That just made me wonder, is there ongoing funding, or do we need to ask for more, or what would be the process to help consider continuation beyond round 6?
In terms of our process,
Yeah, getting funding for the HOWTO program. That's where I know there was money set aside at some point, but then do you go back every few years and ask for more, or how is that?
Yeah, that's a great question. So one of the things that's a little bit different about HOWTO is our funding mechanism. So unlike some other projects that or programs that get sort of a biennium allocation, the funding mechanism for HOWTO is actually tied to an intergovernmental transfer that's based around patient served. I'm going to give a brief highlight. So it's not an allocation, it's a billing back. So our mechanism is in place to continue moving forward. So there's not a process where we have to keep coming back to ask for a particular allocation. And that's also part of where our funds fluctuate, depending on those caseloads. So
thanks. That's probably something I should have known as an advisory committee member, but
well, and again, there's so many different mechanisms. There's so many different programs, even within the same OHA team, and it is unique. And David was here for the start of all of that, but we don't often highlight or spend a lot of time talking about that sort of origin. So it's a great question, Claire. You haven't missed it. We just don't spend as much time on it, probably. All right. Well, on that note, I think we've covered everything that we had on our radar for today. Really appreciate you all and taking the time and your engagement and thinking about what's ahead. We've got our contact information for you all. We also have, and I didn't think to put it on the slide, we also have a HOWTO team inbox. So if you're thinking about how you help to spread the word and someone, you can always send an email to our shared HOWTO email address. Thank you, Neela, for getting the official terminology there for me as I was winging it, that the HOWTO is funded by an OHSU Medicaid intergovernmental transfer partnership with OHA, between OHA and OHSU. Thank you for that, Neelam. All right, anything else as we wrap up and give you a few minutes back in your morning to hopefully take a breath before your next meeting? All right. Well, thank you all again. Lovely to see you all, and I really appreciate your time and energy, and great to have our new faces here on the OHA team to help to support. So thank you, Katrina and Ritu as well.
Wonderful to meet you all. Thank you so much.
Thanks, everybody.